Hello and welcome to Rajya Sabha Television. You're watching COVID-19 India Fights Back. I'm Frank Rausen Pereira. In the steepest weekly fall yet in COVID-19 numbers in India, fresh infections recorded in the week ending October 25th were nearly 16% less than the previous week's tally, while deaths from the virus fell by 19% during this period. India recorded just over 3.6 lakh fresh cases during the week, the lowest in absolute terms in 3 months. This marked a drop of 15.7% from the previous week's numbers, the sharpest weekly fall in cases since the pandemic hit India. Meanwhile, India achieved another positive milestone when the number of recoveries crossed 90% of all cases on Sunday. Numbers fell in almost all states on Sunday, which also coincided with festivals of Dussehra and Durga Puja. Delhi was an exception, recording 4,136 fresh cases, the highest in 38 days. In this edition of India Fights Back, we will analyze the decline in COVID-19 numbers. Joining me on the program today are Dr. Ravi Kirti, Head, Department of General Medicine, AIIMS, Patna; Dr. Manoj V. Murhekar, Director, the National Institute of Epidemiology, Chennai; and Dr. Lakshmanan S., Mission Director, National Health Mission, Assam. Thank you to all my guests for joining me on this edition of COVID-19 India Fights Back. All right, Dr. Ravi Kirti, let me begin the program with you first. Let's try and understand and analyze this sharp decline in number of COVID-19 cases in the week ending October 25.
So, yes, you're right. We've been seeing a steady decline for a few weeks now. I think we peaked around the middle of September, and since then we have seen a steady decline in numbers, which is encouraging. But at this stage, I think we have to be cautiously optimistic. This might be partly because of the good practices, because of the lockdown earlier, and because of people practicing social distancing norms, etc. But also this might indicate at some sort of a herd immunity, because some of the sero surveys have suggested that a large proportion of our population might already have contracted the infection and they might have remained symptomatic. So that means that the virus might be finding fewer people to infect now than it did in the past. Having said that, while we should be optimistic, we also need to be careful, because with the festival season, with the elections in Bihar, it is more than likely that people will be coming in close contact with each other. Plus, we have a winter ahead, and we've seen in other countries that even after a sustained decline for a prolonged period, many of the Western European countries have seen a sharp rise once again. So we need to be careful for the next few months.
Absolutely. All right. So, Dr. Manoj, let's try and understand and analyze now, of course, what is happening as far as, this particular number is concerned and how it is on the decline. Like Dr. Ravi Kirti has mentioned a few things already. But, if you look at how things have changed for the worse in Europe and in America, I mean, after we saw the cases coming down, it has gone up again. But that does not seem to be the case in India at the moment. What is it that we are doing right?
Well, as my colleague Ravi has mentioned, the cases have been going down since last about 4 weeks, and this is certainly a good news. We are seeing a declining trend, but declining trend is at a national level. But there are some states, as you also mentioned about Delhi, or states like West Bengal and Kerala, where the decline is not so appreciable, or I will say the cases are still rising. So one need to be a little careful in telling that there is decline all over in all the states. Yes, nationally there is decline, but in some states the decline is not so appreciable. Well, coming to your question, what India or how we are faring with respect to the developed countries. Well, I think it is too early to say that we are faring better or we have fared better than other countries. And this decline that we have seen in last 4 years is a really good sign, and we need to focus on sustaining this decline in coming weeks and coming months together now. As also mentioned by Ravi, winter is coming and then festive season is coming. So we need to ensure that ongoing interventions are implemented with the same rigor. And we also need to ensure that COVID appropriate behavior is practiced by the entire population, so that the gains that we have obtained till now continue, and we see the decline further in the number of.
So we have to continue to follow the laid down guidelines, laid down protocols. That's the only way to fight the virus at this point in time. The numbers are down, but the scare still well and truly remains, is what the panelists are suggesting. Dr. Lakshmanan, let's talk about the state's role now in what they have done. For instance, from the beginning, they've ensured that they have increase the number of containment zones, all those kind of measures have been taken by the states as well. So it's a combined effort, really. The center has been sending its directives, its guidelines, but the states too doing a major chunk of the work and doing the work on the ground.
First of all, thank you very much for inviting me to the program, and a very happy Vijayadashami to all participants and viewers. As rightly said by Dr. Manoj and Dr. Ravi Kirti, there has been tremendous success in containing the disease but not eradicating it, and this has to be sustained in the coming days. So there have been 2 or 3 major learning points here. First one, we had a very high peak in the middle of September. All over India, probably the highest case was reported on 11th of September with more than maybe about 96,000 cases. And flanked from the first week of September to last week of September, India had the highest numbers, both in the number of cases and deaths as well. But subsequent to that, in the month of October, we have been steadily seeing improving recovery, decreasing number of deaths, and decreasing number of new cases. Exceptional states are there. The same thing when we see the pattern of, let me say, Assam, what we witnessed was that we were having our peak by last of September, not in the middle of September when India was having it. Our recovery is again steadily improving like that of India. We have just passed the national average. Indian average of recovery is 90.1. and we are just at 91. Maybe we will improve, and with our approval, with the approval of each and every state, the national average will also improve. But what are the major causes here? If you think on that line as well, one thing I understand very clearly was that Government of India has been extremely proactive, extremely supportive, extremely looking forward for what is happening around the world and how we can do better. And in this regard, I have to say that from the very outset of the epidemic, when nobody knew much about the system, ICMR and Ministry of Health and Family Welfare have been extremely careful in giving guidelines. They were not giving very random guidelines nor very loose guidelines. For that, I have been, I should say that we all are thankful. And this helped us a lot because initially the states were not having that kind of knowledge nor wherewithal. The initial support really helped, and this also empowered the states to come up with own epidemic control acts and rules. So initially the lawmaking helped, and subsequently whenever new medicines came, new testing mechanisms came, ICMR was proactive. We did not wait too long to go for rapid antigen tests or even antibody tests in a subsequent stage, IgM or IgG. All these diagnostic tests helped us to know better about the disease. And lastly, one good thing what has happened is that the number of cases which has come down has not come down at the cost of reduced number of tests. In fact, I believe sustainability depends upon the number of tests which we do, which has been so far increasing month after month. Even though the number of cases have come down in the month of October, the number of tests have mostly remained at the same level of that of September and August. And probably in the coming months in November and December, we will be able to do more tests as the cost of testing has come down rapidly. Whether it is for rapid antigen test or even RT-PCR test, the consumables, the chemicals which are required for RT-PCR has come down drastically, which has helped the states to maintain good rate of testing. At the end of the day, The awareness of people has also increased their practices. The COVID appropriate behavior has actually rooted in, I will say, in most of the areas. Yes, there are challenges, but still, in most of the areas, people have started to behave in the COVID appropriate manner, whether it is wearing of mask, whether it is maintaining physical distancing, or even hand sanitization in whichever place they visit. This has helped. But how we will sustain this over a period of time when more and more schools will open, the children will start going to school, when more and more business establishments will start working. That is going to be the challenge which we all will have to work together, learn together, and improve together.
Absolutely. Absolutely. Very well put there. I think these things have to be learnt, and we as a community too have learnt a lot as far as the pandemic is concerned. Taking the discussion forward now and bringing in other aspects as well, where we've done well. Let's not forget the fact that, as a nation, as a people, we have done well as far as the pandemic is concerned. Even if you look at the death rate, Dr. Ravi Kirti, it's at about 1.5% is the national average. So that too seems to be going in our favor. Is it because as a people, we are far more immune to the rest of the world? Is it because the strain of the virus that is in India is weaker? What can we attribute to that?
Well, we can only guess about many of these things, but some things are obvious. For example, our demographic profile is different from that of the West. We are a much younger population. The number of elderly people, the proportion of elderly people in our population is far less compared to the West. And we know that the elderly are more susceptible to this infection than younger population, people with comorbidities like heart disease, diabetes, kidney disease, pre-existing lung diseases. They are more likely to have a more severe form of the disease. So that being a young country definitely helped us, number one. Number two, let's not forget that the epidemic arrived in India a little bit later than it did in the Western European countries and America. And by that time, we were a little bit wiser as medical community. We knew a little bit more about the disease than compared to what happened in Italy, Spain, etc., when it just came out of the blue and people were experimenting and trying to find out what was best for the patients. We have some evidence-based treatment, most notably we know that steroids can be helpful in a subgroup of patients, which we're doing now, which we're using now. We know that anticoagulation in hospitalized patients is going to be helpful. So anticoagulation is blood thinning because we know that clot formation is one of the major contributors to morbidity and mortality in this condition. So in terms of medical management, we are a bit wiser. We are a younger country. And also because we knew that it was coming, it gave us a little bit more time to prepare ourselves in creating extra beds with oxygen, ventilators, etc. So I think those are some of the reasons that we can attribute this success to. Some of the other factors, temperature, overall climate, our level of affluence, our level of immunity, whether the virus has mutated, etc., all those are in the realm of conjecture at this stage, I would say.
Absolutely. It's still early stages, really, and something still a lot more study needs to go into to realize and to understand exactly what the issues are and what the factors are. But Dr. Manoj, as far as milestones are concerned, another milestone that we achieved on Sunday was we ensured that there were over 90% recovery as far as COVID-19 is concerned. So is it again the same factors that you would attribute to this as well as listed out by Dr. Ravi Kirti?
Absolutely. I mean, as Dr. Kirti mentioned, generally the disease is mild, especially if it occurs among individuals who are aged less than 60 years and those who do not have comorbidities. So it is very reasonable to expect that the mortality will be much lower in such individuals, or the disease will have milder course. And even without giving any treatment, only supportive treatment, such individuals will recover. and that is what we are saying. The recoveries are increasing, the death rates are lower, and that is what we hope that we will see the same trend in coming days.
Right. And Dr. Lakshmanan, if you look at some of the figures that have come out from the states, some of the more affluent states within the country seem to be doing far worse than some of the so-called backward states. For instance, the death rate, if you look at in Punjab and say Maharashtra and Gujarat, is over 2%. Whereas if you look at the same death rate in states like Bihar, it's at about 0.5%. Why is that so, do you think?
There are two approaches to this. One is if we can see a time graph. As rightly told by Dr. Ravi Kirti, the disease, fortunately for India, happened at a later stage. And even within the country, the cases happened in different states at a different time. Unfortunately, Mumbai had to take the brunt upfront, whereas many states had it in a much later stage. Delhi, Mumbai, and to an extent Chennai, Bangalore, they took the number of cases initially when the treatment facilities were not well defined. Even though medicines were there, see, enoxaparin is not a new drug, it was there earlier. Steroids were there, but whether that was applicable or usable in such a situation was not known. So that was one unfortunate thing, because of which the initial number of deaths which happened in these cities are much more, even maybe in the case of Punjab. But to be honest, when we see mortality, we have to see the time graph. When did this happen? And if we currently see the number of deaths, the number of active cases as on date, and the number of deaths happening now, I believe all the states, including Maharashtra or the states like Kerala, where they are having many number of new cases, still then the number of deaths have come down. Second, mortality, when we are talking about mortality, we are not talking about mortality against the active case, but against the total number of cases. This again has happened is that we have lot of asymptomatic cases which were not earlier being diagnosed or identified, because testing was minimal. There were not many people who were coming forward for testing. But now, in the comparatively changed scenario, when people are allowed to remain at home isolation, earlier people were afraid ki if I am getting tested and getting positive, I may have to move to a hospital or an isolation center. But now people are comfortable to get tested. Even if they are positive, they know that okay, I can take some medication and I can be at home. So now the number of asymptomatic people diagnosed is going up, which also helps in bringing down the statistics of mortality. But unfortunately, even in states which are well performing, there is a huge challenge. That is the number of people whom we lose within the first 24 hours of diagnosis. This is the biggest challenge, because somebody who has come with COVID had taken all sorts of treatment. Unfortunately, we could not save him despite giving best efforts, whether it is for high pressure oxygen or steroid or even antivirals. That is a different case. But people who are diagnosed at a much later stage, for some reason they did not come forward, from some reason they did not test themselves. And these fulminant cases which we are losing within 24 hours are the challenge as on date. It is this portion where every state will have to be careful, every hospital, every district has to be careful, because in this factor alone, I believe across the state, this is happening, and this is one challenge which we all will have to look forward to.
Okay, points taken. All right. So going forward now, Dr. Ravi Kirti, let's first talk about what have we learned over the last 7 or 8 months from the pandemic, what we need to do going forward.
Some of the lessons were learned quite early on in the course of the pandemic, and we need to continue with those things. So if we want to slow down the spread of the infection, the same things would apply that we have known for a good few months now, which are the use of masks, proper hand hygiene, and social distancing. The knowledge is there, but the implementation is getting more and more difficult with the passage of time, because people are getting desensitized and fatigued with staying at home and not mixing with friends and relatives, and the economy obviously has taken a brunt. And so lately we have begun to see people not taking the pandemic as seriously as they did a couple of months ago, and that's a bit worrying, because that might undo all that we have achieved in the last few months. And we must learn from the experiences of other countries that once they started opening up, the graph headed northwards once again. And so we just can't afford to let that happen. So the next few months through this winter, we must continue doing what we have been doing all these years, maintain social distancing, make sure that we're wearing masks every time we go out in the public, try and not gather too many people in a closed space, and of course, washing our hands properly. One thing that we now realize is that probably the risk of transmission of infection from fomites or objects, surfaces that an infected person might have touched, is not as much as we initially thought. So there was a lot of paranoia about these things. When you get anything from the market, you leave it for so many days, you wash it with soap and so on, and people were really getting quite neurotic about it, quite understandably. Now we know that we can be a little bit more sensible with those things. But mask and social distancing are the two main takeaways from our experience so far, and we must continue with those measures. Also, with the festivities and the elections in Bihar, it's very important that, of course, we need to get on with some of the important businesses, but it's very important that we don't lower our guards. I do see a lot of pictures on media and social media of people gathering together for political gatherings, etc. And the masks are conspicuous by their absence. So that's really worrying. We can't afford that at this stage. So next 2 or 3 months, we really need to be very careful. Hopefully, by the end of this winter, a vaccine might be in sight, and there might be. I'm pretty sure that there is light at the end of the tunnel now. But please, let us make sure that we remain as careful over the next few months as we have been up until now.
Absolutely. I mean, I think you couldn't have put it any better. There is light at the end of the tunnel, but we still need to be very, very careful because the virus is still well and truly here and extremely dangerous. So please be careful and follow all the safety precautions and protocols. Dr. Manoj, the best way forward?
Yeah, besides what Dr. Ravi mentioned, as to following the non-pharmaceutical interventions like use of mask, use of, following social distancing and COVID-appropriate behavior, we also need to do what we have been doing in last 9 months, that is, don't reduce your testing. We need to continue testing of suspected patient, individuals. We need to do tracing, contact tracing, identifying high-risk contacts, testing them, quarantining all those who are high-risk contacts, and isolating those who are positive. I think these are some, besides the non-pharmaceutical intervention, these are some of the strategies which the states have been implementing in the last 9 months, which will certainly reduce the risk of infection, the transmission, and we'll see the graph declining in coming months.
Absolutely. And Dr. Lakshmanan, close the show for us with your concluding remarks.
One thing that we already have learned is that COVID was a really big, is a really big challenge. But even then, we had shown the resilience to fight it as a community, as a unit of country. We had been successful in fighting it together with a lot of confidence. Now it is high time that we should also focus on the issues related to health which were out of focus because of COVID. We do have other essential services, whether it is maternal health, whether it is child health, whether it is non-communicable diseases, which actually is a huge burden for the country. And when COVID became a huge issue, some of these issues were not given the required focus. So it is now the time to give equal, if not more importance to our regular issues, which relates to maternal health, child health, because IMR, MMR and immunization itself was challenged because of emergence of COVID. This is one point. Second, there have been reports of COVID-related complications. The people who recovered from COVID not having any more positivity or infectivity but who are developing cardiac, pulmonary, or even circulatory complications. There has been report of pulmonary fibrosis and even myocarditis and cardiac arrhythmias across the country. This is going to be a challenge which we are not yet fully aware of. What will happen to those COVID people who had recovered but are having some sequelae? So these are the challenges which will come in the coming days. But again, I'm sure we have learned, we have stood together, and we will also get this challenge very well taken.
Absolutely. All right. On that note, then I'll call it a wrap on this edition of COVID-19 India Fights Back. Thank you to all my guests for joining me on the program and putting things into perspective for us. And before I leave, I'd like to make an appeal to all of you. Rajya Sabha TV would like to appeal to all its viewers to follow all the safety measures and wear a mask at all times. Wash your hands and your face regularly and ensure that you follow physical distancing and keep a minimum distance of 6 feet. These small measures can go a long way in defeating the pandemic. That's it from me. See you again next time.